Hello everyone, I'm Jim Longworth and welcome to another edition of Triad Today, coming to you once again from the beautiful Senior Botanical Garden in downtown Kernersville. We'll tell you more about them later on. And later on is when the roundtable is going to show up and we'll get into all sorts of controversial topics, so stay tuned for that. And for the entire program, we have a lot of great topics to cover. We have some special guests. We'll talk about bicycle safety and much more. But our first guest is familiar to Triad Today viewers, and I wrote a note here to make sure I didn't forget. He's been appearing on this show since February of 2011. He's a High Point native. He's been a teacher, a military chaplain, and he's been president of Randolph Community College for since 2007, a lifelong educator of about 30 years. And we welcome back our good buddy, Dr. Bob Shackler. Good to see you.
Thank you, Jim. Good to see you.
I want to get to some of your background and some other things and looking forward in a second. But basically, recently you sort of shocked a lot of people and said, I'm going to retire, effective in July. Why now?
Well, after my family has followed me all these years as a minister, a military chaplain, educator, 15 years as president of Randolph Community College. For some reason, they've decided that it was their turn. My children said, Dad, we know you. You'll work till they carry you out on a stretcher. Could you save us this much?
Yeah, they wanted some of your time.
Well, my granddaughter, let me tell you this, my granddaughter said, Papa, that college will have other presidents, but you're the only Papa I'll ever have.
Hey, out of the mouth of babes.
What do you say to that?
30 years as an educator. Why, you could have gone so many different directions because you have done some different careers. Why the focus on education?
Well, Jim, I grew up very poor. My family and I lived in a little trailer, moved around because of my dad's work, and I didn't have a prayer. I had no idea what I wanted to be or ever could be. And my mom told me, if you get your education and work hard, you can be anything you want to be. I got my education. I've lived my dream. My passion is to take that gift she gave to me and give it to other students who were where I was.
And you have been doing that with other students who have a great success rate of sticking with it and being qualified to move right on to jobs. And speaking of jobs, you helped to drive one of the driving forces for the Guilford Randolph mega site. And all of a sudden now that's paying off big time with the Toyota electric battery plant coming in. Very quickly, don't have to spend a lot of time on it, but just what's the economic impact of just something like that?
It's going to be profound in the whole region and actually in the whole state. They're investing $1.3 billion, going to create 1,750 jobs at over $62,000 a job. And in phase two, another couple $1 billion, another 3,000 jobs. Overall, the impact would be new housing developments, new schools, new churches, new communities, and probably when it's all said and done with all the supply companies, it's probably going to bring in 1,500 new jobs, 15,000 new jobs.
And the interesting tribute to you, although I know you don't like to brag on yourself, but here you are sort of on the front end trying to get this company here, which is going to produce jobs, and on the back end, you're helping to train the people that are going to work there. So I think it's a great testament to you. Also, I want to mention the Allied Health Center, which I know you wouldn't say, but it's named after folks at home. It's named after Dr. Shackler for the Allied Health Center. But why was it needed, and what's it going to do for the students?
Well, when we first built our health center that we had, it was just a nursing building. We've added so many health programs since then. We're out of room. We're scattered all over the campus in closed space. We now have a state-of-the-art, high-tech, simulated hospital, Allied Health Center. And it's going to create jobs that are going to stay right here in the Triad. It's supplying the need for nurses, radiographers, all kind of health related jobs that are not going to be transported overseas. They're right here. And well-paying jobs right here in the community.
I know we could spend a half hour, 2 hours, whatever, talking about this, but very quickly, give me an example of something you're proud of that we were able to accomplish at Randolph Community College while you were president.
Well, one of the things that comes to mind I hear about all the time in the community is a number of years ago, I campaigned for a 1/4-cent tax referendum. In fact, I remember I gave 55 speeches in 7 weeks.
I remember that.
And I was told by a bank president, Randolph County wouldn't vote for a tax increase to usher in the second coming of Jesus, but we won, and it ended up bringing $24 million to RCC for advanced technology, the Allied Health Center, and so much more.
And it helped a lot of places throughout the state when others sort of followed in your lead and talked about referendums and things. I want to put up, before we lose time here, just a bit of a quick plug to the college. Randolph.edu is where you can find out more information about all their award-winning things they're doing in the photography department. I mean, I could go on and on about the things that have been accomplished since Bob took over. And we hope that, I feel like I need to applaud your service and also to say that you're always welcome back on the show to come visit.
Thank you, Jim. It's been an honor.
All right. You take care, my friend. We'll be right back. Back now on Triad Today, and I'm excited about this service that we're going to talk about because it really gets to the heart of meeting the need of what we are looking at here in terms of healthcare in our area. I'm so proud of the work that this lady's doing. Jessica Imes is Director of Community Engagement for Novant Health. Welcome to the show.
Thank you. Glad to be here.
You've recently launched a mobile clinic. Now, what do you call it?
We call it the Novant Health Community Care Cruiser.
The cruiser. Now, what was the need that you saw for this cruiser?
So at Novant Health, we're always trying to improve the health of our communities. And one of the ways that we try to do that is through just being intentional with what the community needs. And we're trying to address social determinants of health, which are the factors that affect healthcare outside of our clinics. And so some of those things are transportation or housing, education, access to food, just basic human needs.
Yeah, hard for a lot of people to get to see a doctor.
It really is, and that's what we kept hearing. We heard that transportation was a huge barrier, and so we wanted to build this cruiser to actually take care out into the communities we serve and really make a difference in the communities who need us the most.
What kind of services would the cruiser offer? Can the cruiser offer?
Yeah, so it depends on the day, really, and the needs of the community. We are trying to be intentional about tailoring our visits and our offerings to the community based on what they need. So some days it might be a free, health screening, just a general A1C check. We call them Remarkable You screenings that have BMI, blood pressure, A1C, and things like that. Or it might be connection to primary or specialty care resources and clinics, connecting the patients to our physicians outside of the cruiser.
So they can kind of refer if
Yep.
they need to be to
And
specialists.
we also are planning to have some community healthcare workers on the cruiser who are able to connect patients to social needs as well. So being able to refer to a food clinic or a food bank, we hope to have some of those resources on the cruiser as well to be able to say, oh, you have an immediate food need. Well, here's a pack that you can take and be able to, impact the patient that way.
I think that's great. Now, are there particular areas of the community that the cruiser will be at other than other areas?
Yeah, so it really depends on the need. So we're trying to be intentional, again, like I said, about how we impact the community. And so we have a big focus on East Winston right now, really impacting the community there. But we'll be able to take it wherever we can, wherever we need to.
That's the term mobile, as I should have known before I asked the question. But seriously, no matter where I'm living, if I want to avail myself of this, how am I going to know what day the cruiser might be near me or what the schedule might be? How would I know that?
So we're trying to be very intentional in these communities. So, working with local leaders and canvassing the community to tell them what's available and where we're at, where we're going to be, and what we're going to be providing. But then we also will have that available on our website as soon as we're up and running. And then we have a manager of community health services that we've hired who is very familiar with this community and is able to connect patients and help us to schedule all of those opportunities and make sure we are getting the word out.
What a great service. Now, are you already thinking ahead? Would there be other cruisers, other mobile health clinics in the future, or what do you I know it's too early because you're just starting up, but what do you think?
Yeah, absolutely. I think there's always the opportunity. So this is the first Novant Health Community Care Cruiser that we've started in community engagement. Really excited to launch it right here in the greater Winston-Salem market. And we're hoping to replicate. We're actually building 2 more right now
Wow.
already.
Okay.
One for our coastal market, which includes Wilmington and Brunswick, Pender County. And then again, we're building one for Charlotte as well. So I'm excited to serve Mecklenburg counties and surrounding counties with that unit later this year or early next year.
I think that's great. Now, you said when up and running, but for now, let me just at least give the general website, novanthealth.org, which gives you all sorts of good information about services and facilities that you can check into, and then just keep in touch. And with the mobile cruiser, I just think it's a great project.
Thank you. We're really excited about it.
Thanks for doing it.
Absolutely. Thank you.
We'll be right back after this. I want to start is talking about the hunger problem in our area, what we're doing to abate it with our good friend Eric Aft, who is CEO of Second Harvest Food Bank of Northwest North Carolina. Welcome back to the show.
It's good to be with you, Jim.
Remind folks who might have just moved into the area what the mission of the food bank is.
Well, at Second Harvest Food Bank, we address the immediate challenge of hunger in our region, which unfortunately is substantial, as well as we work to address root causes wherever we can through job training, nutrition education, and other programming.
We're trying to get back to normal from the pandemic, although it's still with us, but trying to subside. But I guess people would expect that the question I'm going to ask you is, gee, what did the pandemic do to us? Rather than ask that, my question is, the hunger problem was bad before the pandemic. So where are we now?
Yeah, that's really true. Folks don't realize that hunger is a reality here in Northwest North Carolina. It was about 1 in 5 children face uncertainty where their next nutritious meal is coming from, and 1 in 7 individuals overall. Now, the numbers for kids are about where they were pre-pandemic, but that's an unacceptable level. Overall, it's about 1 in 6, so it's still at a little bit of a heightened challenge. And unfortunately, we're seeing a sharp increase in requests for assistance right now.
And how are you trying to meet that need?
Yeah, one of the things that all of us have dealt with are supply chain issues, going to the grocery store, or, going to seek other items that we need in our household. And that's a reality for us. So we're having to purchase more food than ever before. Literally, pre-pandemic, we were using about $400,000 to purchase food, and we're on track once again to have another year where we're spending about $4 million to purchase food.
$4 million.
That's
Good
exactly
grief,
right.
Eric. Now, how is, I know you have the new headquarters coming underway, and how is that coming along, and what's that going to allow you to do additionally?
It is coming along very well. There's great excitement on our team. Every time I drive on the lot and see 18 refrigerated trucks and know that we have off-site storage, we know that we are in desperate need of this facility. But the bottom line is that more nutritious food, more job training, more involvement opportunities for the community, more nutrition education, and more impact by Second Harvest is what the new facility will bring.
Yeah, not that we rehearse this or anything, but I recall you telling me one time before that in the past, in the old days, it was always, well, let's collect canned goods. Let's collect non-perishables. But with the new headquarters and other things that you're doing, you're going to be able to do what, more produce and stuff?
That's exactly right. That's the heart of what we all eat. It's the healthiest items, produce, frozen and fresh items, and we'll more than double our cold storage capacity at the new place. And again, that just means that we'll be able to get healthier items out to our community.
I heard you guys are doing something called the Summer Match. What is that?
It is. During the summer, kids are out of school. Sometimes when kids are in school, that is the main meals that they get during the day.
Right.
So we want to step up our efforts, and we want the community to join us in that. And we've got a number of generous donors who have said, we're going to match dollar for dollar up to $350,000 to help with summer hunger needs. And so anybody can join with Second Harvest to match those donor dollars and help even more.
People could be listening to this segment saying, well, gee, Eric, sounds like you got everything under control. Does the community still need to really support you?
Well, the fact that we're investing more money than ever to purchase food, we have to continue that. And we need that investment from the community to make it possible. The supply chain issues makes it more difficult for us to secure food on a timely basis. So again, those investments, whether it be money or food donations,
Right, need them both.
Are desperately needed.
Need
They
both
really
of them. Up on screen, this is how you can help us learn more about what Eric is talking about. Second Harvest, NWNC. Of course, that stands for Northwest North Carolina. I'll say it again. Second Harvest, NWNC.org. Please check that out. It gives you all sorts of information about the food bank, about their mission, about all the good work they're doing, and how you can help. Eric, thanks for all you do.
Jim, thanks. We appreciate you and the community.
All right, man. We'll be right back after this. Now on Triad Today, time to talk about bicycle safety and safety in general with two guys that know all about it. In fact, I feel very safe with them all the time anyway. On my right and distance behind, the Daggett Schuler guys. I call them David Daggett, Griff Schuler, partners, Daggett Schuler, attorneys at law. Good to see you guys.
Hey, Jim.
David, let me start with you. I want to get to that because we have a bike helmet here, so I know we're going to get to that. But before we talk about that, here's something I don't think I've ever asked. Why is what kind of clothing is important to wear if you are riding a bicycle?
So clothing when you ride a bicycle should be comfortable and it should be colorful. So there's special clothing built for bicycling. You don't have to dress like an elite athlete in Lycra and spandex all the time. There's very nice casual clothing that is meant for bicycling. That's important. I could go through a whole bunch of things, but there's clothing so that your pants don't get stuck in the chain, and that's
Right. Should you have knee pads on, or?
well, depending if you're off-road and the type of cycling, but there's a whole array of casual biking clothes for the casual cyclist. But bright colors are important so that you're visible.
Stand out.
Visibility is big.
Griff, I've actually, this is going to sound like a stupid question, I've actually seen this happen before. If you're out riding your bike on a road or a street, and it's kind of busy, maybe even not a small highway, I've seen bikers sort of weave in and out of traffic, and well, I'm going to go this lane and that lane, and I'll just wait until this car passes, and I'll go. Is that a good thing to do?
That is not smart. Number one, you should follow the rules of the road. Be on the far right-hand side of the lane of travel, and you shouldn't be going in and out of cars. One thing to remember is, I think cyclists are very knowledgeable of this law. I don't know that many motorists seem to know this law.
And I want to ask you about some of the North Carolina law in just a second, too.
You're supposed to have 4 feet distance between you and a car and the cyclist. And I think one of the biggest mistakes I see motorists on the road doing is when they go to pass, particularly on a 2-lane road, they're much closer to the cyclist than 4 feet.
Well, all right. And I've seen, couriers in big cities, they'll weave in and out, although it's kind of dangerous. David, all right, let's get to the helmet. Tell me why a helmet's so important and the fit for the helmet's so important, and then I'll...
Yeah, so the number one thing in bike safety is a helmet. This helmet's actually rather old, but a helmet is cheaper than a brain exam if you crash and hit your head. But basic fit is you want to have a chin strap that fits well. You want the helmet to be tight here, usually 2 fingers above your eyebrow, because that protects this whole rim around your head. Most of the new helmets have a dial or some sort of tightening device. It's called a rock lock. This is your rock, this is your lock. And this helmet you can actually tighten down that even without the straps, it stays pretty snug in place.
So you want it snug, but not too tight.
Right. You want it to stay in place when you crash. This one's been crashed.
It has. Now that brings me to my other question. You had a rather personal experience with this, right?
Yes. So it's going to happen. I've cycled in the neighborhood of 300,000 miles on the road. If you cycle any sort of volume, at some point you're going to go down, kids go down. Wearing a helmet is very, very important. Helmets are designed with a slick surface that skids across the road. This one's carbon fiber reinforced. It's a very advanced styrofoam, very similar to what a new TV or electronic device comes in. It's packed in styrofoam.
Right.
Exactly the same principle, but a little bit higher technology. This one is broken in about 6 pieces.
I want to get back to one other thing real quick before we lose time, Griff. Isn't it all about common sense and courtesy when you're talking about bikers and motorists and safety and all the things even David mentioned?
Absolutely. Be courteous to one another. Share the road. I think that's one of the biggest things. Share the road. Don't try to pass when you know you don't have the clearance to get around a cyclist. I think a lot of times people that when they're in their car, they just aren't being smart and they aren't being courteous.
And for the cyclists, be good ambassadors.
Yes.
Because what you do affects me when I'm riding my bike.
Right.
If we're all good ambassadors, it all gets better.
And this guy knows what he's talking about. He rides a lot. Speaking of safety, check out safesober.com if you would. That's an interesting website, too, of something we talked about on this show before. And also dag@schulerlaw.com if you should need the services of these gentlemen, or call 724-1234. Guys, I appreciate this so much, and thanks for promoting safety in all ways. And you're going to stay over for the roundtable, right?
Yes, sir. Thank
right.
you, Jim.
Thanks, Jim.
We'll be right back after this. Back now on Triad Today, just about time for the roundtable, but a quick shout out to our good friends here at the Senior Botanical Garden. You can go to their website on screen, or you can come out here. Lots to see. And if you were right here right now, you'd see this. these guys on the round table. On my right, Ogie Overman, the great broadcaster and journalist, and held over by popular demand from his segment talking about bike safety, David Daggett of Daggett Schuler, and Keith Granberry, founder of Helping Hands Consultants. Guys, before we get to our regular topics, very quickly, just sort of don't want to spend a lot of time on this. Anything surprise you about the primaries that were held recently? Ted Budd seemed to get all the undecideds instead of them being apportioned. We had a couple upsets in commissioners' races, the bond pass, school bond pass in Guilford. Anything quickly, Ogie?
I was surprised at the margin, Jim. I didn't think he would run away with it like that at all. I thought McCrory would do a lot better showing than he did.
Yeah. David?
I wasn't surprised by the results. I was surprised by the margins. We had a couple school board issues in Winston-Salem that surprised me a little bit. But other than that, about what we expected.
Keith?
Yeah, I thought that it was going to be a McCrory-Budd runoff. And it shocked me how many people just turned to Budd, the undecided, especially in a moderate type of...
they flooded over to him, yeah. All right, now, to our main topics here. We now know that the city of Greensboro has agreed to pay a promoter nearly $400,000 not to hold gun shows in the Coliseum for the next 5 years. Are you guys okay with taxpayers footing the bill for keeping gun shows out of the city? Now, nobody believes that guns are good, inherently. I'm not saying that, and maybe there should be gun control. We've talked about that. But for taxpayers to pay $400,000 not to have a gun show, Ogie?
I need to talk to Matt Brown about why he doesn't just not book them.
Just don't, yeah.
Why don't you just not book them?
This bothers me, though, David.
Well, the problem is they booked them, they had to get out of the contract.
Yeah, I guess so.
And because of that, they then had to address the present issue. So I think they did the right thing addressing the present issue. That shouldn't be a long-term plan of action to use funds in that manner.
Keith?
I'm not concerned about a gun show. I'm concerned about the laws where people can actually use guns. It's a gun show does not concern me. They should have went in with the gun show if you're going to keep the laws the way they are.
All right. We've talked about shootings at Haynes Mall before, and each time I ask the same question. I'm going to throw it out there one more time. Guys, shouldn't malls like this be required to post armed guards or armed policemen with one of those handheld metal detectors at all the main entrances? Ogie?
I'm just not there yet, Jim. If you want to kill the malls, which are already in decline, go ahead and do that, and you just wipe them all out at once.
David?
I'm agreeing with Ogie twice in a row for different reasons. I don't think that should be legislated and enforced. Does there need to be more safety? Yes, there needs to be more safety. There needs to be more awareness in our neighborhoods. Keith, on the last question, what he was insinuating is we need better gun laws. That would help that. It's a bigger picture than just metal detectors.
Keith?
I think, number one, that you do need metal detectors. I mean, in Atlanta, Lenox Mall, which was a great high-end mall, now it's turned into a battlefield. And they've had to put metal detectors and security officers there so that normal, decent people could actually go shop.
Yeah, and spend money.
Absolutely.
Okay, safely. The state of Texas just passed a law that allows users to sue social networks for censoring their posts. The law recognizes social media platforms not as social media, but as internet providers. So if you get kicked off of Twitter for saying something crazy or false, you can now sue in Texas for being denied access to the internet. You okay with this law, guys? And would you like to see North Carolina adopt it, Ogie?
It's a double-edged sword, Jim. I mean, there's certain people that do need to get kicked off Twitter, Trump and people that spread hatred and disinformation. But there's innocent people who get set up by people who hold a grudge. It happened to a dear friend of mine. Took her 6 months to get her account back for nothing she did.
So you think it should be able to sue?
There need to be a recourse for people to get back on it.
David?
Yes, social media and social media law is evolving. And remember, laws and regulations always trail the event by some degree. So as social media continues to evolve, our rules and regulations are going to continue to evolve. Do we need them? Yes. Should somebody that spreads intentionally false information be entitled to access? I don't think so.
Keith?
I agree with Dave, but also
Again?
yeah, but also, you know, I wouldn't follow the state of Texas for anything. I don't know why we even having this conversation.
We thought they were going to secede anyway,
That's
didn't
right.
we?
I don't know what this is about.
Nothing secedes like success. Guilford County now recognizes Juneteenth as a paid holiday to commemorate the end of slavery, but it's still not a state holiday, so we got some confusion over that. Should it be a state holiday? Quickly, Ogie.
Absolutely, yes.
David Daggett.
Yes, it probably should. It's time we recognize that and wrap our arms around it.
There's confusion because some state employees are saying, wait a minute, it's in Guilford, you know, we don't have to go to work. But yeah, we have to go to work because we're state employees. What do you
Should be
think,
a
Steve?
state holiday.
Should be a state holiday. All right, and finally, guys, a new study by CNN shows that 1/3 of Americans do not bathe or shower daily. Meanwhile, some medical experts say that you need to maintain some germs on your body. Guys, do you have a lot of germs on your body, Ogie?
I have to admit, during the pandemic, my hygiene probably went down a bit.
So you had some
I didn't
germs.
bathe every day.
Dave,
That's why we knuckle, right, Ogie? We got germs on our body. Yeah.
you have a lot of germs,
I
David?
probably got some germs, yeah.
Keith, you have a lot of germs on your body?
I don't have no germs on my body. My body is absolutely clean. I have no germs at all. I am clean.
Yeah. I
You
don't-
feel me, Jim?
I don't know. I know I'm not going to feel you because the three of you are all dirty as far as I'm concerned. You're filthy. All right, well, that's all the time we have. Oh, except for this. A team of researchers at the University of Michigan now conclude that the best way to grow healthy flowers, shrubs, and bushes is to fertilize them with human urine, which may explain why the Senior family keeps wanting the roundtable guys to hang around the garden so long. Do you understand that, Ogie? It's David, yeah. All right, for all of us non-dirty guys, I'm Jim Longworth. We'll see you